Chairman, ladies and gentlemen, I'm honored to be here today to share my insights with you on technology innovation and transformation in healthcare. As we all agreed, we live in times of serious healthcare peril. However, it's also a time of great opportunities for human beings to rethink how we could stand up against this healthcare uncertainty and gain the benefits from technologies. I'll start from the challenges we face globally, then talk about the transformations that are taking place in healthcare, and address how AI can contribute to healthcare. This talk is designed to act as a springboard for the 2 days webinar. Let me begin by showing you our predictions from the United Nations. You can see the global population is aging. Declining birth rates is a global issue which heavily impacts the economies of APEC members. The proportions of older persons in the world is projecting to reach nearly 12% in 2030, 60% in 2050. Within 10 years, it's very likely that some of APEC economies will become so-called super-age society, which means the number of people aged 65 and over in the economies would account for 20% of the population. The aging population is leading to the increasing old, which means old age dependency ratio, which is defined as the number of old age dependents who are 65 years old or over per 100 persons of working age. The number is expected to more than double between 2019 to 2050 in Asia. You can see the blue line here in Eastern and Southeastern Asia. The older will rise from 80 older persons per 100 workers in 2019 to 43 in 2050. The higher ratio indicates more financial stress on working people and possibly political instability. More and more people claim pension benefits and fewer people work and pay income taxes. Population aging is driving physician shortage. According to the latest finding from the Association of American Medical Colleges, with older physicians leaving the workforce and older people require more medical cares. This infographic here points out how chronic diseases impose substantial burden on our economies and society. It says that 80% of seniors above 65 years old have at least one chronic health condition, and 68% have two or more. These days, people around the world are seeing their livings being shortened and even shortened due to one or more chronic conditions. Chronic illness is a dynamic, ongoing process that is determined by a complexity of factors. The control of chronic conditions requires constantly focus on medical care and personal health management. However, in the face of this widespread virus, what if you need a regular checkup? Would you rather stay at home by yourself, or would you like to take a risk going to the hospital? The finding here suggests that people will tend to avoid doctor's appointments during the pandemic. However, for people who have one or more chronic conditions, especially for the elderly, it's very important for them to get help from medical professionals regularly. A study in Canada showed office visits declined by approximately 80%, but virtual care increased rapidly in Ontario, Canada. Same here, the number of doctor visits decreased by more than 20 million in Chinese Taipei in 2020. The telemedicine has been applied to outpatient clinics recently. The COVID-19 pandemic is profoundly changing the way health care services are delivered and consumed. Even in Chinese Taipei, where we are known for its accessibility and the efficiencies of healthcare, we are adapting our use of telemedicine as the pandemic rages on. The concept of decentralizing healthcare had already been applied in recent years, but it becomes more popular as a result of COVID-19. Decentralizing healthcare focuses on moving forward community-based healthcare. However, it won't just happen without applications of AI, big data, and wearable devices. Let's take telemedicine as an example. We won't expect to get enough help from the doctor remotely just because we turn on the camera in the video conference, just as we did. The sensors, which collect detailed real-time data on the physiological status of patients, will have to play a vital role here. Now, more and more people are willing to use a wearable device to keep track of their health. From this chart, you will see connected health monitoring devices revenues is expecting to grow steadily. It's predicted to grow 34% in 2021 as more people checked for COVID-19 symptoms and mentioned chronic conditions from home. We believe an anticipated shortage of doctors and nurses in the hospitals and the significant difference of doctors to patient ratios are fueling the usage of remote patient monitoring systems, which in turn is boosting the wireless patient monitoring market. For example, AI makes it easier for seniors to age in place as seniors play an active role in daily chronic disease management. statistics show 87% of the 87% of the seniors wish to age independently. It also shows seniors living with sensors lived 1.7 years longer than those living without them. They don't only live longer, but also save more money than those living in nursing homes. As the more data we collect, the more information we can provide to primary medical providers in the process of health care. Accordingly, primary care is where the power, opportunity, and the future of AI are most likely to be realized in the broadest and the more ambitious scale. There are 4 top functions of primary care which can be supported by AI. According to a study published on News of Family Medicine last year. Here we can see AI is most used on diagnostic decision support, where AI help conduct doctors' data studies, performs image interpretations, and the medical analysis, as well as to assist medical personnel in making a diagnosis. The other 4 functions widely supported by AI are diagnostic decision support, treatment decision support, information extraction, and prediction. What kind of benefits can AI bring us? We can talk about it from the primary care provider's point of view and the patient's point of view. AI can help remove or minimize time spent on routine administrative tasks, which can take up to 70% of healthcare practitioners' time. So AI can free up doctor space for patients and shift the focus away from transactions tasks to personalized care. AI can augment a range of clinical activities and help healthcare practitioners access information that can lead to better patient outcomes and higher quality of care. It can improve the speed and accuracy in the use of diagnostics, give practitioners faster and easier access to more knowledge, and enable remote monitoring and patient empowerment through self-care. Here we can see how healthcare AI technology can improve both patients and healthcare providers' outcomes enumerously. Findings have shown that on average the use of AI can achieve 12 hours reductions in hospitalization days, 12% reductions in the number of 30-day follow-up visits, and even reduce the waiting time in outpatient clinics by 80%. For healthcare providers, it can increase the accuracy of diagnosis to 95% and save the healthcare systems over $20 million annually. For years, Chinese Taipei has been committed to promoting substantial innovation to support digital transformation in healthcare through the integration of AI technology and their services. Following up on AI policy making, we need all stakeholders, industrial players, and the governments to work together and build a new healthcare ecosystem powered by AI. This is a Chinese proverb that goes like this: when water flows, a tunnel is formed, which means that everything will work out in the end when it's time. Finally, I would like to end my talk with a chapter in the book of written by Confucius disciples from 2050 years ago. It says, when the Great Way reveals, the world community is equally shared by all. The elderly is provided for till their death. The sick and the disabled are all well taken care of. I believe this still resonates with our hopes of an ideal society today as people were then. In present times, with AI, we have the potential to give everyone the health care he or she needs, anywhere and anytime. It is the power to truly democratize healthcare and will help human beings to achieve the age of great harmony. Today, we are building a better future. Hope you all enjoy today's policy dialogue and tomorrow's best practice sharing. Thank you very much.